Gene editing lately saved the lives of 2 child girls who had an incurable form of leukemia. Now, the equal form of procedure has been used to cancel out all the symptoms of a French teen's sickle cell disease. Sickle cell disease is the one which particularly impacts people of African, Caribbean, Middle Eastern, Eastern Mediterranean, and Asian origin. Around 275,000 infants are born with it every single year. They suffered of extraordinarily shaped, sickle blood cells thanks to a coding error in the gene for hemoglobin, the oxygen-carrying section of red blood cells. Which means that the blood cells can't flow easily around the body, occasiaonally get trapped in various kinds valves. The results of this lifelong circumstance are complicated and varied. However, most typically the affected person from bouts of excessive anemia because of the inefficient shipping of oxygen. They are also at a higher risk of contracting main infections, and can suffer from occasional, extraordinarily painful paroxysms called sickle cell crises. Stunted increase and strokes are also symptoms in some cases. The conventional treatment cannot cure it. The most effective to potentially cure it to date has been to use bone marrow or stem cell transplants from a health donor, which would permit the patient's body to supply healthy blood cells. It's work, but the risk of a dangerous immune reactions wherein the transplanted cells begin attacking the patient's normal cells is regularly too high. As reported by a study in the New England Journal of Medicine, a teen was added to Necker Children's Hospital in Paris back in 2014 for a game-changing therapy. A particular gene, it's able to induce an anti-sickling impact on red blood cells, was inserted into the patient's own stem cells using a changed virus. The cells had been then allowed to convert into red blood cells, which then started to proliferate around the patient's body. 15 months later, the boy, now 15, is not suffering from many of the impacts of sickle cell disease. It seems that at least 50% of his blood cells have normal hemoglobin and are normally shaped. Even if it is not a cure for the disease, that treatment has established effectively that the symptoms had been quashed, and he is off all other forms of medication and treatment. The gene therapy was composed by scientists at Bluebird Bio based out of Cambridge, Massachusetts. They have been handled 6 other patients with sickle cell disease in the same way, and even tough the effects have yet to be posted.